Hello friends, so let's welcome to all of you. So today we will start and learn about the 834 file layout which is generally used in the HIPAA for ANSI X12 834 file layout. So what is the 834? I will tell you in this video the 834 transaction sets represent a computer like benefit enrollment and maintenance document. It is commonly used to communicate health plan enrollment information. This is the simple file layout as you can see over on the screen. First ISA segment. This is the segment ISA called the segment, and start from the ISA 01 and how you can read this information. And the first is from start asterisk sign is from the end asterisk sign. The between information is called the value. That's like you can see 01. This is the ISA 01 value. And what is the information in ISA 02? There are the 50 digit 0, okay, and I is 3. This is the value of the I is 3. This is the information as I is 4. This is the information double z as I is 5, and this is the information as I is 6. And what you can see mostly in this IS segment, this is the IS header line. Okay, interchange control number. Okay, interchange information you can see over in the ISS segment, and ISS 6 is represent the sender ID of the client or receiver. Okay, and ISS 08 is called this receiver ID. After that, you can see the date, and you can see at the ISS like 10 time, and after that you can see the repetition separator. You uh, after that you can able to see like this is the ISA 014, this is the acknowledgement requested. This is the acknowledgement requested, yes or no. If this is file is accepted, acknowledged, then it's called one. Otherwise, it's showing the zero. It's mean this file is not accepting the acknowledgement. So that's why it's showing the zero. And after then P. P is the user indicator. If this is the test file, then it will show the P. T. If this is not the test file, the production file, then you can able to see the P. Okay, in the GS segment, if we start from the GS segment, segment start from the work for the like group functional code. Okay, so group functional header, you can also see this, and GSS 01 and GSS 02 and GSS 03. You can see the information till the GSS 08. Okay, so what is the important thing you need to know? First one is the qualifier, and second one is the value. Okay, at every time. Okay, so you need to be just understand like if you are able to see this is the qualifier, this is the actual value. So you can see it here. GH02 is the sender ID, GH03 is the receiver ID. Okay, GH04 is the date, GH05 is the time, and you can see the control number GH06. And okay, after that, if we jump on the ST segment, this is a transaction header, transaction set. How many transactions and like which of the transactions we are working on this file? This file is created for which transaction set. So this is represent the 834 file that we are able to see. Okay, and BGN segment, this is provide information of the date of the birth, and REF segment you can see are the division number, REF 38, like you can see policy number as well. If we talk about the DTP date time, so you can also see that what is the date of the start date and date you can able to see. And n1 is represent the company name, like what is the company, what is the client name. Okay, yeah, the P5 section. In the INS information, if we talk about, we can see the INS information for the member level information. And you can see ISS 01, ISS 02, sorry, INS 01, 02, 3, 4, and 5. Okay, and this means A is showing the active member. Okay, and REF 0F, this is called the subscriber SSN, subscriber number. You can also see the REF 0F segment. Okay, and if you talk about the NM1, PER, N3, N4, all these transaction segments are there, which is represent the information of the member. Okay, this is the address, this is the employee name, this is the address, and this is the city, state, and chip. Okay, DMG, this is the plan year information, which of the plan year employee has been uh, enrolled in the plan. And HD segment, this is the health coverage information. You can see HD 03, HD 04. Okay, and DTP, this is the plan year and date. This is 38, DTP 39. Okay, plan is started and ended as well. REF1L is the group number or policy number, the account number as well you can see, and the REF1L. Okay, and as this is called the start, and like if we have seen the ST transaction set it start, and this is going also to sign into the SE segment. It's been how many transaction set of the number are total number of the transactions that we can able to see at 16 at there. And GE segment, this is the start envelope to GS, and it's going to end envelope at the GE, which is the total number of functional group are there. How many functional group are there? One. Okay, these are the number. And IEA and IES start from the start interchange header, and this is going to be end of the interchange trailer is the end envelope as well. You can see how many ISA interchange number are there. So these are the file layout of the 834 as you can see. If we talk about the INS member level information, RF0 as subscriber number, group location, divisions, and hire date. If we talk about the NM1, NMI, employee name, N3, employee street name, address, employee address, TJ, JIP, and DMG member demographic information, actually coverage information, DTP 39, 38 coverage details, and 30, 49. 48 and 49 is the coverage and started and date, IN is for the N for the dependent, Y for the subscriber. Segment detail, if you can see, although member level detail, if you want to see INS Y, this is Y in the constant value, Y is for the subscriber and for the dependent. Relationship code starts from the 18 for the employee, 01 for the spouse, and 19 for the child. And for the full file, it's called the 030, and XN for the region code, and A is used for the status code, active and Cobra. Medicare plans are like E is no Medicare and D for the Medicare, Cobra qualifying event is performing or not, FT for the full time and PT for the part time information. RF0, if we talk about the RF0 information for the subscriber SSN, okay, is the constant value and no dashes used. RF1 is the account structure for the RF, like what is the actual value of the client or vendor has provided to you by the group number. Okay, and DTP 336 hard date, and the DTP 336 you can see the constant value of the hard date, which of the most recent hard date of that employee. And M1 information you can see the employee last, you can see employee last name, employee first name, middle, prefix, suffix, constant value, SSN coming, and member even SSN. N3 used for the employee street, and what is the street address one and address two information are there. And for employee city, state, and chip, you can see the information. If we talk about the GMG, DMG member demographic information are there. So had a date of birth and gender, female or male. Okay, marital status. What is the is single, married, divorce, or legally separated or unreported. Okay, actually coverage health coverage information is you can see which of the plan is usable, like VIS for the vision plan, employee, how many which of the coverage tier is using the employee, employee plus child, employee plus children, families. Okay, there's two dependent, multiple dependents are there, employee and one dependent are there. You can see that information. Okay, for the DTP 34 to 48 health coverage dates are there. DTP 30 like with the constant date, benefit begin start date. You can see in the 49. You can see the benefit termination date as well. INS information segment member level detail you can able to see in the relationship code as well, and status code like active or Cobra employer there. Okay, medical plan codes like Medicare, Medicare part, and Medicare not. Okay, for D, and Cobra qualifying event as well. Employee status full time, part time, student status full for the full time for the full time, and for the not for the student. Handicap indicator yes or no. Transmission explanation, here as you can see in the SD segment used for the start of the transaction set and specify transaction set had control number as well. If we talk about the BGN segment, this is original transaction uniquely identified by a sender with references, and transaction was created like that date and at that time. If we talk about the N1 and P5 information, specific the sponsor sender ID and tax ID number of client FAN ID as well, you can able to see of the receiver ID number as well. And the INS segment, you can able to see indicative like employee information name and adding their coverage and employee information and employee subscriber SSN. And after the NARIF panel, you can see the group number as well. And the DTP, you can eligibility date, transaction, which of the date has started, and After that, these are the common information as you can see over on the screen and over on the file as well. And for the info for use of the GIF and DMG used for the date of birth and gender of that employee, and HD segments represent the health information, benefit information, what the coverage year electing, and benefit under which of the date has started. So these are the things we can able to see over on the screen. And thank you friends. If you like my video, please like and subscribe this channel, and I will provide you all the information related to the ADI videos. And if you like it, and you can also have this video in the interview as well. So thank you friends. If you like my video, please like and subscribe this channel. Thank you.